Hi, my name is Winslow E Dixon. I'm a published author, a holistic health practitioner, and a sufferer of medullary sponge kidney. And I'm going to do a video to talk about my story, and hopefully some of you can relate. So I was diagnosed with medullary sponge kidney at age 25, but I started having kidney stones and chronic urinary tract infections at age 15. Nobody really knew what was going on. It was kind of intense. And I, in fact, developed another condition called adrenal insufficiency because my body was so taxed due to the unmanaged pain, the constant passing of stones, and basically the overall havoc that it wreaked on my body. So I was diagnosed, like I said, at age 25, but I wasn't diagnosed in a normal way. I was at Cleveland Clinic already for the treatment of adrenal insufficiency, also called Addison's disease. And the great thing about Cleveland Clinic is that they work in a continuity of care, which basically that means that doctors will work with other doctors to try to help you get the care that you need. And I was referred to many of the urologists, and the first one didn't really know what to do with me, put me on lemon water, which definitely increased the stones, and I figured out why later. But it was kind of a tailspin. And finally, I ended up being referred to a female urology specialist who happened to intern with a person who had medullary sponge kidney. So she immediately recognized the markers for the disease, sent me through the testing for it, and sure enough, I was then diagnosed with medullary sponge kidney. And I remember the day that I got the testing done, they showed me on the screen the sponge kidney, and I saw the little cystic dilations. And I remember the tech just standing there beside the screen, and he looked at me and he was like, "I'm so sorry." Because within the cystic dilations, I had multiple embedded stones that were in the kidney wall. So I got a full view of the reality of what medullary sponge kidney does inside your kidney. But I was very grateful to have gotten a diagnosis, and I was then able to analyze my stones and do the 24-hour urine test and really get answers as to why I had been tormented by these kidney stones since such a young age. So if you have just recently been diagnosed, let me just tell you, first of all, I'm sorry that you have it, but you're not alone. And there are definitely many, many things that you can do to try to manage this condition. And I learned that there's not a whole lot of education and research on it. And in fact, most urologists and nephrologists may not have even really heard of the condition. So I have worked in advocacy and patient care for the last 10 years, and I was running a nonprofit research organization. And I just decided that it was time that there was some more information on medullary sponge kidney. And so I have seen Dr. Goldfarb at NYU nephrology, his letter explaining MSK floating around, some of the support groups and things. And so I reached out to him and I asked him if he would be interested in putting his letter in the book, and if I could have permission to do so. And then, I asked him a few questions about the demographic and his practice with the patients and those sorts of things. And so I was very grateful that he did respond to me by email and things like that, and allowed me to put his letter into the book. We also put out a survey that surveyed over 100 medullary sponge kidney patients internationally. And it basically asked questions like, do you have pain associated with your MSK? Have you tried alternative therapies? What kind of kidney stones do you have? That sort of thing. And so it was very interesting to see that there was so much validation within just the groups of how, we all dealt with this thing and how we had similar symptoms. So I definitely was glad to see that that was a part of it. I was also glad to see that once I dug through PubMed and, some research journals, there was quite a few supporting, studies and articles on medullary sponge kidney that reflected what the survey results said. So that's all in the book. And I honestly, I did it as a gift to other people. I really hated how invalidating it was when you would go to an emergency situation or a new urologist and they really didn't know what you were talking about. And they were like, oh, it's a benign condition and things like that. And oh, obstructive stones only hurt. And it's like, yeah, okay. So I wanted to compile something that would prevent us from being gaslit, because all of us are too gaslit in this community. But anyways, the book is available on Amazon and Barnes and Noble. It's in paper book and Kindle form. I'm hoping to get it in ebook form at some point, but it's there. So just Google Manage Medullary Sponge Kidney by Winslow Dixon on Google, and it should come up for you. But and if you do read it, please let me know what you think. I really hope that it helps people and it validates, what we go through, because MSK is far from benign for some of us. So anyways, thank you for watching this video, and I wish you hope, healing, and happiness.